So what are the pre-bariatric care points, right? So when a patient comes into your OPD, you physically examine the patient, you measure their anthropometry, you categorize where do they stand in BMI terms. So you grade them as grade 1, grade 2, grade 3 based on the body mass index. So once we grade them, then we have to tell them what are the types of bariatric surgeries we do or what is more suitable for that candidate. So before that, I would like to tell you what are the types of bariatric surgery. So basically, there are various modalities for weight reduction surgery. So there is something called as restrictive procedures, something called as bariatric malabsorptive procedures. So restrictive procedures, coming to it, it intends to restrict the amount of food intake of the patient. So falling in that category are gastric sleeve resection, gastric banding, which is nowadays not much done, or it is almost getting outdated, and one more is endoscopic balloon placement. So these are all the procedures intended to cause restriction of the food intake. So coming to gastric sleeve resection, where when 85% of the stomach is out, patient to ability at any given point of time, he can't binge it. So might be you would have eaten some 10, 6, 7 idlis, could take around half a idli at a time. So this is a procedure where we restrict the patient food intake by in turn causing the weight loss. So these restrictive procedures are always like a sort of a healthy punishment. In this procedure, even the patient eats a minimal quantity, it will be absorbed properly because it follows the normal GI tract. So this is called as gastric sleeve resection, and the weight loss effect is quite good in this compared to gastric adjustable banding.